One of the questions we got from a member of the community is, after repeated denials, like what is my recourse? What should I be doing? And can you speak to sort of the rationale, or sometimes the lack of rationale, behind some of these denials that seem like they should be covered by insurance companies that we're paying a lot of money to?
Right. So this is something that I deal with every single day, right? So as a physician owner and owner of my own practice, when I see a patient in the hospital, or if I see an outpatient, I have to write a clinical note. My clinical note has to incorporate ICD-10 codes, which is essentially what justifies how much I can charge the patient for the visit, essentially. So I order the medication. The medication has to go to their insurance, and then their insurance looks at the medication cost, looks at their ICD-10 code, and will say, this ICD-10 code isn't good enough. You have to rewrite your note, or they won't even say that. They'll just say, we're not paying for it, right? And the same thing that happens on the patient end. And basically, I don't want to say it's the doctor's fault, but if something's not being covered, either that patient didn't know that it wasn't covered in their plan, which can be an issue, and nobody knows everything about their plan. B, the physician's at fault because they didn't write the note well enough for the insurance plan to understand what is going on and understand the FDA indication for said product. So I think that what has to take place is a conversation between patient and physician, and the physician understanding that plan.
So in some cases, what your suggestion is to folks when they get denials is to go back to their doctor and say, hey, like, can you approach it differently in terms of your next request to the insurance company?
Yeah. What can we do different? Now, again, I didn't learn any of this in medical school. I didn't learn any of this. I had to learn all of this on my own afterwards, right? The business of medicine. When you are a young kid and you just finished residency and you go work for a system, you just do the work for the system. They're responsible for collecting the money. If you go out on your own, you're going to get a lot more of this. What you didn't know is behind the scenes, all of your support staff was helping you with this, adding things to your note, adding diagnoses that you meant to add that you just didn't quite add, to make sure that things can go along and become smooth so that insurance companies are doing what they're supposed to do, which is take care of patients.